Hello, my name is Ed Hickey and I serve as Vice President of the American Association of Kidney Patients and Chair of AAKP's Veterans Health Initiative. A few years ago, I was diagnosed with chronic kidney disease and have been working with dietitians to slow the progression of my disease and have made good progress. AAKP's Medal of Excellence is the association's highest honor for healthcare professionals, recognizing individuals who are committed to improving and extending the lives of all kidney patients through advocacy, research, technology, and quality-driven treatments that protect patient dignity and fully align with patient aspirations. It is my distinct honor to present the 2021 Medals of Excellence in the Dietetic Category to three very deserving individuals: Katy Wilkins, Schiro Harvey, and Jessie Pavlinak. Katy Wilkins founded the Washington State Council on Renal Nutrition and the Northwest Renal Dietitians Conference, helping to connect renal dietitians across Alaska, Idaho, Montana, Oregon, and Washington. For Ms. Wilkins, the primary role of the renal dietitian is to teach, and she finds it rewarding to offer information that can lead others to a healthier future. Katy, I turn it over to you.
Well, thank you, Ed, and thank you so much to AAKP for this award. I am so thrilled to know that several of my longtime patients nominated me for this award, and I'm really pleased to be included with Harvey and Jessie Pavlinak, both of whom I consider giants in the kidney nutrition world. The three of us have worked together since 1982, trying to improve standards of nutrition care for people with chronic kidney disease, for people on dialysis, and for those with kidney transplants. It's really an honor to be considered in their league. I have worked with patients facing the uncertainty of kidney disease for over 40 years. During that time, they have given me the gift of not just seeing, but feeling the courage with which they face their lives every day. They are the ones who really deserve this award because they choose to live every single day, and in doing so, I think they inspire the rest of us to do better at whatever it is we do. Thank you so much.
Thank you very much, Katy. Our next recipient is Schiro Harvey, who has worked as a renal dietitian for 38 years and is currently Director of Nutrition Programs for Puget Sound Kidney Centers in Washington State. Ms. Harvey has authored, co-authored, and edited many renal nutrition publications, including professional manuals, textbooks, peer-reviewed publications, and patient education pieces. Ms. Harvey learned early in her career that by listening to stories about her patients' families, the food they like, their traditions, and how they plan, shop, and cook food, she can work with them to plan ways to eat healthy diets and live the life they want while on dialysis. Kathy, I turn it over to you.
Thank you, Ed, and thank you, American Association of Kidney Patients, for this great honor. This was an organization that was created by patients for patients, and to be honored by that group of people is the highest honor I could ever achieve. Thank you so much for acknowledging my work and the other dietitians that have been working for people with kidney disease for many, many years. I also need to thank Katy Wilkins, my colleague who is also receiving this award. Katy hired me fresh out of college over 40 years ago and inspired me and gave me the opportunity to stay in this field. I learned pretty early on that this is what I wanted to do with my life. Katy and I didn't have a lot of evidence guidelines to support us at that time. Renal nutrition was a new field, and we pretty much winged it. We listened to our patients, we gave them brief guidelines, but basically we learned from them what was going to work and what wasn't going to work to help them eat well, stay healthy, and survive on dialysis. Thank you, Katy, for this opportunity and for mentoring me for all these years, inspiring me to keep fighting for our patients. After a few years in nephrology, Katy and I ran into Jessie Pavlinak, who is also receiving this award. Jessie was another great inspiration to me. Working with these two women for years helped inspire me to continue the fight for patients with kidney disease and also to support nutrition research, nutrition therapy, anything we could do to help the lives of our patients and the people that worked in that field. So thank you, Katy, Jessie, and all the dietitians in this country, all the professional organizations that represent us dietitians. You have been an inspiration to me and have kept me focused on this field. But by and large, the biggest thank you I have is for my patients. People on dialysis are the bravest people I know. They are my heroes, and I realized this early on in my career. Even after a few months working in dialysis, I realized these people inspired me to make a choice every single day to live, to fight to live every day, and it wasn't an easy battle. So many things they had to overcome to survive on dialysis and have quality life. And I learned early on that it wasn't my job to tell them what to do. It was my job to listen to them and guide them on that journey. And for whatever reason they wanted to live, I was going to support that. That didn't mean they all did the right thing by my standards, but it meant they did the right thing by their standards. And those are my heroes. I think back on the thousands of dialysis patients I've worked with in my career, and I have such fond memories of so many of them. Their families, their grandchildren, their friends, all the pleasure and joy they brought to my life, and the kind memories I have now of them. They are an inspiration to me, and it's because of them that I am in this field and continue to do this work, and that I am honored by the AAKP. So thank you to all the dialysis patients, all the kidney patients I've worked with. Together we will continue this fight to conquer this disease and make life better for all people. Thank you once again, AAKP.
Thank you very much, Kathy. Our next recipient is Jessie Pavlinak, recently retired as manager of clinical nutrition at Oregon Health and Science University in Portland, Oregon, where she practiced for 41 years in the area of renal and transplant nutrition and clinical nutrition management. Ms. Pavlinak believes that engaging people, listening, and individualizing the nutrition care plan allows the person to be successful. Jessie, I turn it over to you.
Thank you, Ed. I would like to thank the American Association of Kidney Patients for this prestigious Medal of Excellence Award for renal dietitians. To receive recognition from a patient organization is the highest honor I have received over the 40-plus years I have been in practice in renal nutrition. The AAKP recognizes professionals who are committed to improving and extending the lives of all kidney patients through advocacy, research, technology, and quality-driven treatments that protect patient dignity and fully align with patient aspirations. Nutrition intervention is an integral part of the care of patients in all stages of chronic kidney disease, including transplantation. Providing the tools a person with CKD needs to manage their diet and nutrition needs leads to improvement in quality of life and medical outcomes. I've had the opportunity to work with many patients, adults, pediatrics, non-dialysis, hemodialysis, peritoneal dialysis, and transplantation. All of those patients I have worked with has shaped my approach to person-centered care. I would like to thank Dale Rogers, a kidney transplant recipient from Idaho and an AAKP board member, for nominating me for this award. Dale is a member of Network 16 Patient Council. I am also a member of the Network 16 Medical Review Board and Board of Directors. The Patient Council of Network 16 is integral in making sure we focus on quality patient care for those patients within the network. I would also like to thank the patients, the dietitians, nephrologists, transplant surgeons, nurses, social workers, and pharmacists at Oregon Health and Science University who I've been blessed to work with during my career. I would also like to thank OHSU leadership, who was supportive of my involvement at local and national organizations involved in renal nutrition. In closing, I would like to congratulate my fellow Medal of Excellence Dietitian awardees, Katy Wilkins and Kathy Harvey. The three of us have worked together for over 3 decades on several important kidney nutrition projects, including the first national nutrition guidelines to standardize care. These amazing dietitians have given their professional lives to making the lives of kidney patients better through nutrition. Again, thank you, AAKP, for this prestigious honor.